This segment sponsored by Femme Medical Spa. We are kicking off a brand new series called Women's Health Wednesday, and we're so thrilled to get this knowledge and education by OBGYN and surgeon Dr. Ashley Scott with Femme Medical Spa. Hello.
Hello.
How are you?
Good. Thank you so much for having me.
Yes, I'm so thrilled that you're here. I know that you have so much experience, and you're just a wealth of information. And so I'm thrilled that we get an opportunity to have this conversation just real and open so that viewers can feel connected with you and also learn a lot.
Yes, yes. I love to teach, so I'm happy that we're here to do this.
Yes, okay, so let's just start with the basics. Just kind of give us a background of your medical profession and your current spa.
Okay, so I'm a board certified OBGYN, so that means I can take care of women in their pregnancy, deliver their babies, and then manage their postpartum care. But in addition, with the gynecological side, I can care for women throughout every stage of their life. So from adolescence all the way, through their menopausal transition. And so, it's not just about a head to toe physical exam. If there's pelvic pain or fibroids, abnormal bleeding, we can help to address all of those things.
Yes.
But then in addition, since I started Femme Medical Spa, I have also branched into obesity medicine because as women go through, the menopausal transition, there's a lot of shifts that happen, with their bodies. And so I felt like, okay, well, that's an important area of medicine that we should incorporate as women health providers. But then along with that, then we also have branched into aesthetics as well.
Yes, I mean, so much to offer. You have such a unique concept that you brought to Fort Wayne by combining the two, having a medical spa, but having the services as an OBGYN. So I think that's exciting because it makes it a one-stop shop.
Absolutely. And that was exactly our goal. And we wanted to make sure that when women came to our facility, it didn't feel like, any other medical practice. We were trying to be very intentional with our approach to how we wanted to take care of women.
Yeah, which is great. And so with that, though, you made a decision recently to go back to being an OB to the GYN.
Yes. So, truthfully, I've never gotten out of the obstetric side of it. I was primarily just doing it in a hospital setting. But I felt like right now was a really good time to now start to take on my own patients again because, as we all know, the face of healthcare is changing rapidly in this country. And it is further leading to the increase in morbidity and mortality among women. And so I wanted to make sure I could be part of the solution.
Yeah, it's funny because when you had told me that you were adding that back, you're like, you miss delivering babies. You miss the process of caring for the mom and seeing her through, and I thought that was lovely.
I do. I'm like, oh my goodness, I love holding the babies.
Yeah.
And so I usually am like, please bring your baby to the office so I can love on it.
Yes. Okay, so let's talk about the maternity mortality rate that you were talking about. What are we seeing now in numbers? Because it's so sad that the care is not being given the way they need.
Yes. So, even though in the United States we are one of the most developed countries in the world, when it comes to morbidity and mortality for pregnant women, we're not doing so great. And in Indiana, the story is not much better when we're thinking nationally. And the other thing is at least 77% of these deaths are preventable. And so if we can focus on giving good quality care and helping to build that relationship between the physician and the patient, then hopefully we can bring those numbers down.
Yeah, absolutely. Especially being an African-American provider, I know that our numbers are much higher.
Yes.
The risks levels and also just the care sometimes gets overlooked and it's documented.
Yes. So, it's not a surprise that, we have a very difficult history in this country. And because of that, there is some distrust in the healthcare profession in general as it comes to patients. So I do try to be cognizant of that. And, we do have to approach some of our African American patients a little bit differently because they do usually carry a lot more risk. Even when we control for income and education, they're still twice as likely to have a increase in morbidity and mortality.
Why is that? Like, what puts us more at risk, and what are some of the signs that you recognize?
So, Overall, I would say there's a lot of different factors that can play into this, but we do know that there is biases that exist.
Right. Yes.
And so one of the things that we can do is really just help to educate women in our population. So helping them to understand that even before you get pregnant, you have to make sure you're healthy, before the pregnancy ever happens. So that's what I like to do in my office. We like to do that preconception counseling to make sure your blood pressure is well controlled and all of your labs are normal. You're still eating healthy and exercising. Those things don't stop just because you're pregnant.
Right. That is so good. Preparing the cavity for conception, for sure. And so I guess as women kind of think about the steps and stages when it comes to preparing for motherhood, and at what stage would you say they should start to see you? And I say that because is it best to start off on the gynecology side and then talk to you in that process prior to getting pregnant?
Yes, I think so. I mean, I think you always want to make sure that your relationship with your provider is one where you feel like you can speak up and you feel empowered, to advocate for yourself. And so maybe doing that when you first are pregnant, it's not bad to do, but if you already have a relationship with your provider and you know that this is someone who you can trust, then it might be easier to make those conversations in pregnancy happen.
Right. Yeah. And I have to add that your facility, of course, is so beautiful and welcoming. I mean, if y'all haven't seen it, we'll show you clips of it because it's pink, it's plush. You want to set that comfortable environment and not a sterile office, right?
Yes, absolutely. We wanted to make certain that women felt like this was for them. We were very intentional with the colors and the fabrics. And, a lot of people may have thought I went overboard, but I did on purpose because I wanted it to be a place where they felt like, okay, I can rest all of my inhibitions. And then that allows for an easier conversation to talk about things that, you may be worried about.
Right. And that's why I'm excited about this series. And there's a lot that people have to look forward to as we have this conversation. As I said, I've talked to you. Full disclosure, Ashley is my gynecologist. And so I just trust in your knowledge and I just think that you're so deep in the information that you share. So give us a little tease what we can expect over the next weeks and months as we have this convo.
So I would like to be able to talk about things that, there's a lot of myths out there in terms of women's health, whether it pertains to pregnancy, fibroids, menopause. And so I want to be here to dispel those myths and to be able to open up the conversation for women to start having and hopefully help to maybe stop some of the shame with discussing some of these topics.
Yes, I love that. Okay, well, we're going to do this.
Okay.
We're going to do this. I'm so excited.
I'm very excited too, so yeah.
Well, good. Well, thank you for joining me today.
Thank you so much.
And if you would like more information about Femme Medical and Spa, we'll have their website listed below. You can check out all of their services from OBGYN to their medical spa as well. And I'll see you after the break. This segment sponsored by Femme Medical and Spa.